Hi, my name is Brooke Swindle, and this is going to be my medication administration video. For the first part, I'm going to show you how to find the landmarks for where you would give injections. First, I'm going to start with the vastus lateralis, which is on the leg. To find this one, you take your left hand and find the greater trochanter, and then you would find with your right hand the lateral femoral condyle, and it's around here. It's the bottom portion of the bone where it meets the knee. You're going to lay your hand above the knee on it. And then you're going to make a rectangle with your fingers. My thumbs make a line and the tips of my fingers make a line. And I would want to give the shot in the middle third of this box, so right about here. Next is the ventral gluteal. This one I'm going to have the patient on their left side. Their right hip is flexed. And I'm going to take my left hand and find the greater trochanter again. And if you have trouble finding it, you can have the patient move their leg up and down. I have found it. It's right here. So I'm going to take, it's right here. I'm going to take my thumb and point it towards the groin, my index towards the axillary, and then I'm going to move these three to the side. And then I have the V. The shot, I would put an alcohol prep here, and I would do the shot about here. Next is the intradermal shot. I would give that in the forearm. I would find where the antecubital bends and the elbow, place my pinky there. I would take my other hand and find the wrist, and the shot would go somewhere in here. You'd want an area with not much hair, no bruising, not venous, and no scarring or anything like that. Lastly, I'm going to do the deltoid or intramuscular shot. So I would find the acromion process. It would be the bone near the top of the elbow. Place my pinky on it, lay my hand flat, I'm going to move my index to make a triangle, and I would give the shot somewhere in this area. That is how you find the places to get the landmarks to give shots. This is the medication administration part of my video. So when I enter the room, I'm going to check my physician's orders and see that this order is for Jonah Doe. I'm going to see if they have any allergies. They have none, according to the record. And so I'm going to see what the physician has ordered. They have ordered insulin NPH 10 units sub-Q every AM, insulin regular 5 units sub-Q every AM, Rosefin 500 milligrams twice IM twice a day, and we have on hand Rosefin 500 milligrams per 1 milliliter, and a TB skin test, Mantox tuberculin 0.1 milliliters ID times 1 dose, and we will read it in 48 hours. So I'm going to hand hygiene, and I'm going to get ready to get out my medications. So I'm going to open up my medication container, and the first one I'm going to get out is the insulin NPH. This is for Jonah Doe. Insulin NPH, insulin NPH. 10 units. There's enough in this bottle for 10 units. Sub-Q every AM, so at this time. And I will check the expiration date and see that it is in date. Next, I will check my insulin regular for Jonah Doe. Insulin regular, 5 units. There is enough here for 5 units. Sub-Q every AM, so at this time. And I will again check the expiration date on this and see that it is in date. Next, I will check for Jonah Doe the Rosefin. Rosefin, 500 milligrams. And I know 500 milligrams is equivalent to 1 milliliter. There's enough in this bottle. It is to be given IM twice a day, and one of those times is right now. And I will also check the expiration date and see that it is in date. Lastly, I have a TB skin test order for Jonah Doe. So tuberculin, 0.1 milliliters. There's enough here for 0.1 milliliters. ID. I will check the expiration date and see that it is also in date. Now I will move to my station to draw up the medications. So I'm going to set out my medications. The first medication I'm going to draw up is the insulin. And while I'm going to go ahead and clean the tops of the 2 insulins, And while they're drying, I will check it against the order again. Then I would discard these. Now while those are drying, I'm going to check it against my order, against the MAR. This is for Jonah dough, insulin NPH, 10 units. There's enough here for 10 units. It's to be given sub-Q every AM. It says at 800. It is that time. And I will again check the expiration date to make sure it is in date. And with this one, I will gently shake it, get the substance that's at the bottom mixed in. I will not shake it vigorously. And I will check to see that it is all well incorporated. And it is. Next, I'm going to check my regular. This is for Jonah dough, insulin regular, 5 units. There is enough here. Sub-Q every AM at 800. It is that time. And I will again check the expiration date and see that it is in date. So I will get my insulin syringe. Excuse me. I will uncap it. I'm going to lay it down on its side. And I'm first going to draw up 10 units of air. And I'm going to inject that into my NPH. And withdraw. And make sure my needle is not bent. Next, I will draw up 5 units of air and inject that into my regular. And now I will draw up my regular. And I draw it up very slowly to ensure I get no air bubbles. I'm going to pull it out straight. This is 5 units of regular. And I know 5 plus 10 is 15, so overall I will have 15 units. So to drop the 10 units of NPH, I'll draw it up till the 15 mark. So now I'm going to put it in the bottle and draw up 10 units of NPH. And again, I drawed it up very slowly to ensure that I have no bubbles. I'll pull it out, make sure my needle is straight. And I will show you here is 15 units. Now to put the cap back on it, I will use the scooping method. I will scoop up the cap and click it on. And then I have already pre-prepared my labels on my bags. So this says this is for Mr. Doe, insulin, NPH, 10 units, regular 5 units to be given sub-Q. So I will put that in my baggie. And that one is ready to be given when I go to administer them. Next, I'm going to draw up the Rocephin. So I'm going to check it again. This is for Jonah Doe, Rocephin, 500 milligrams. There is enough here. This will be an IM twice a day, one at 0900. It will be that time soon. And I will check the expiration date again and see that it is in date. Now I'm going to go ahead and clean the top. And when I draw this up, the order is for 500 milligrams, and I know 500 milligrams equals 1 milliliter, so I will draw 1 milliliter. I have on a filter needle for drawing up the medication. I'm going to draw up 1 milliliter of air. And I'm going to inject that into the vial. Then I will flip it. And I'm going to draw up 1 milliliter I'm going to check for bubbles. I see there's a small one, so I'm going to draw up extra and flick it to get it to go to the top. And I'm going to push up the extra till I get to the required amount I want, which is 1 milliliter. I have that, so I'm going to flip it, eject it, and I'm going to go ahead and put on the safety cap since this is a longer needle, and then I will show you that I have the correct amount. There. Here is 1 milliliter of Versephin. Now I'm going to put it in my baggie. I'm going to check the baggie. It says, so for Mr. Doe, Versephin, 500 milligrams equals 1 milliliter to be given intramuscularly. So I'm going to first change out the filter needle before I put it in the bag. I'm going to remove the filter needle. And I'm going to put on the needle that I will give it with, which has a safety guard. Now I will put it in the bag. And that medication is now ready to go as well. Lastly, I'm going to prepare the tuberculin, and I'm going to discard this needle in my needle box. So for the TB, I'm going to check and clean it and then check it against the order one more time. It says, from Jonah Doe, tuberculin, 0.1 milliliters. There's enough here. ID, it is to be given at 0900. It is that time almost. It will be when I go to give these. And I will again check the expiration date and see that it is in date. So I will get my needle. I will uncap it. I will fill it with 0.1 milliliters of air. And I will inject that air into the vial. And now I will draw up my 0.1 milliliters. And I am drawing it up in slowly to ensure I have no bubbles. And if I do, I will get rid of them. There we go. And I'm going to recap it real quick before I show you, because the cap does not get in the way or interfere with it. Here is 0.1 milliliters of tuberculin. Now I will prepare to put it in my bag. That says for Mr. Doe, Mantox tuberculin, 0.1 milliliters intradermally. So I will drop it in my bag. I will seal it. And all my medications are prepared and ready to be administered. So I would put up my medicines, I'd put them back up and clean up the area for the next nurse. And I'm going to go to the room to administer these medicines to Mr. Doe. I would not enter the patient's room. They would say, come in. I would enter in hand hygiene as I enter. And I would ask them, I'd say, hi, my name's Brooke. I'm a Bevel State nursing student, and I'm helping your RN today, and I'm going to be giving you your morning injections. Can you tell me your name and date of birth, please? And I would compare it to the armband and the record and see that they would tell me their name is Jonah Doe. Their birthday is 6/22/55. And if I wanted, I could also check the hospital number to the band. So I'm going to explain all the shots that he's going to get the 3. He's going to get a tuberculin, insulin, and Versephin. He'd say, okay. And I'd explain why he's getting each one, and he would say he understands. I would ask if he has any allergies, even though I've already checked the record. He'd say, no, I have no allergies, and I'd say, okay. And I'd get prepared to give him his shots. So, the first shot I'm going to be giving is the insulin. And I'm going to, again, check it to what the doctor has ordered. For Mr. Doe, insulin, NPH, 10 units, regular, 5 units, sub-Q at this time, And I cannot check the expiration date again because I do not have the vial on me. And I would compare that to the record as well. Now, I'm going to hand hygiene and apply my gloves. While I'm applying my gloves, if wanted, I could chat with the patient, ask them how they're feeling, if they need anything after I give them their morning injections, if there's anything they want. And once I get my gloves on, I'm ready to give them medicine. So first off, I'm going to see if I can give it at a 90-degree or 45-degree angle. If I can pinch up 2 inches of fat or skin, I can give it at a 90-degree angle. If I cannot pinch up 2 inches, I will have to give it at a 40-degree angle while holding up what I can pinch. But with this patient being 180 pounds, and I can pinch up 2 inches of fat, I can give it at a 90-degree angle. So I'm going to clean the site, and I'm going to clean it in a circular motion, and dispose of my alcohol prep. Now that I've done that, I would give the site time to dry. Now that the site has dried, I'm ready to administer the insulin. So I'm going to uncap it. I'm going to spread the skin. I'm going to, in a dart-like fashion, inject it at the 90-degree angle. And then I would stabilize, and I would inject slowly. Once I inject all the medication slowly, I would wait 10 seconds so that the medication could not follow the tract back out. Once the 10 seconds is up, I will remove it. And I would throw this in the sharps container, but for the purpose, I'm going to recap it and put it in the sharps container. And I would apply a Band-Aid. Now I'm going to give the Rosefin. So I'm going to grab my Rosefin, and I am again going to check it to the medical record, the medication administration record. So it says Rosefin for Jonah Doe, Rosefin, 500 milligrams per 1 milliliter to be given intramuscularly at this time. And I cannot check the expiration date because I do not have the vial on me. And I do not have to change my gloves because they are not soiled. And it's not required with these types of medications. So now I'm going to clean the area. And now I'm ready to give Mr. Doe his medication, the Rosefin. This one will be given at a 90-degree angle, and I will do it in a dart-like fashion. I will use a method called the displacement method, where I displace the skin, and I will give him the shot at a 90-degree angle. And now I will stabilize while still displacing, and I will aspirate some. If there is no blood, I am good to give him the shot. So there is no blood. Now I will slowly inject the medication. Once I go to remove the needle, I will remove the needle and my hand at the same time so that the skin will shift back and there's not a tract for the medicine to come out of. And then I would activate the safety guard, but for the purpose of saving our needles, I am not, so I'm going to recap it. But I would activate the safety guard and put it in the container. Now lastly, I'm going to be given the TB test. With the TB test, I'm again going to check it against the order. Jonah Doe, Mantox tuberculin, 0.1 milliliters, intradermally, at this time, and I cannot check the expiration date. So now I'm going to remove my needle from the bag, and I'm going to prep the site that I'm going to give it to. It's a little hard to clean a hot dog, but I have now prepped the site. Now, and then I would let it dry. Once it is dry, I'm ready to administer the medication. I will inject this medication at a 15-degree angle, bevel up. I will inject it where it's just slightly above the skin, then I'll go a few more millimeters, stabilize, and I will slowly inject the medication. And it formed a little whelp, but it ran back out. I don't know if you can still see it or not. And for the purpose of saving the needles, I will again recap with the scooping method and dispose of it. And now that I have given all the medications, I will draw a circle around the TB test, and I would have applied a Band-Aid to the other two. Now that I've removed my gloves, I would dispose of them. Hand hygiene. And again, I would check with the patient to see if there's anything they need. If not, then I will document the shots. This is what my documentation would read. April 20th, 2020 at 0800, fingerstick blood glucose was 158. Insulin NPH 10 units, regular 5 units, administered sub-Q in the left lower quadrant of the abdomen. No bruising noted. Side rolls up ×2. Bed locked in lowest position. Call light in reach. Reminded patient to call for assistance out of bed. Signed, student nurse Brooke Swindle with my credentials. April 20th, 2020 at 0900. Explained reason for TB skin test. Patient verbalized understanding that test was necessary to be accepted into the nursing home. 0.1 milliliters of tuberculin, purified protein, lot number 35536, injected ID in right forearm. 1-inch circle drawn around the bleb. No reaction noted 5 minutes after injection. Inform patient that test will be read on April 22nd, 2020. Instructed patient not to scratch, apply lotion or cream to site. Do not scrub the site or apply a bandage over it. Signed, student nurse Brooke Swindle with my credentials. Lastly, April 20th, 2020 at 0900. Rocephin, 500 milligrams per 1 milliliter administered IM in right ventral gluteal site. No complaints of pain, numbness, or tingling. Signed, student nurse Brooke Swindle with my credentials. Thank you. Have a good day.